Well, thanks for that, Sharonette. My name is Amy Gonzalez, and I'm the project manager for the DETAC. Welcome to our first cohort of this e-learning community. We are delighted to have everyone here today. I am just going to give a very brief kind of introduction of expectations that you can have for us, the DETAC, and what we expect from you as participants. Some of you have formerly been in our e-learning communities, but we want to let you know what you can expect from us. First of all, we send calendar invites to you. We send meeting materials in advance, and we also send meeting recordings. So if for some reason you missed an important element, you had to log off early, you maybe chimed in late, you'll have those recordings to look back to for notes and to maybe share with other team members. Sometimes if, maybe one of your teammates can't attend for some reason, or there's a conflict, right? And you guys are gals are dividing and conquering. We also provide you with a team of talented subject matter experts who have deep knowledge in the practices and the topical areas that we are talking about, who can share their experiences, who can guide you and really support and cultivate a really rich discussion through these e-learning communities. So this is a community, right? We're all working together to talk about employment and to learn how we can take a deeper dive into the world of work, right, as it pertains to the people that we serve. We also provide accommodations. We today have CART and ASL. If you do need those accommodations, please either send myself or Sharonette Weldon, who is the coordinator for the DETAC. Let us know that we need that you need these services, because they are provided on a needs-based basis. And so if we don't get anyone telling us, oh, I need ASL, I need CART, then we don't request the service. And we really, this is so weird. My Pandora is just like turning on randomly. I'm sorry about that on my phone. So please let us know if you need CART or ASL, so we can be sure that next time around for the session 2 that we have those services for you. One more thing is that Sharonette creates a Google group specifically for this cohort, for these participants, you and this community. That is kind of the central location of where we send recordings, materials. There are instances where group members will share some really cool stuff they're doing, or documents or MOUs or policies, whatever it may be. That is kind of the central repository of where we share and kind of post information. Now, if you have not gotten an email from that silrise2@googlegroups.com, if you do not believe that you have been included as a participant, please share your email in the chat so Sharonette can add you or your colleagues to that group, because we want to make sure everybody has access to that, okay? What we expect from participants, it's not much, just that you are arriving, and participating in the meetings, asking questions, feeling comfortable with having just rich discussions about the content that we're talking about. Again, we are a community here, and we really bounce off that peer-to-peer and the idea sharing and just connecting, right? Because we are here to support each other. Sometimes we need support, and it's good to have that circle of support here. And that's pretty much it. That's all I wanted to share. So I'm going to turn it over to April and to Dr. Lydia. Again, thank you for being here, and we're really looking forward to engaging with you. Oh, and one more thing. At the end of the sessions, we have a survey. It's called a post-event survey, and that is your opportunity to be heard. Let us know what you really appreciated about the e-learning community. Let us know if there are additional e-learning community needs that you have or would like to see in the future, or if there's maybe technical assistance that you might want from Dr. Lydia or from April. If you want more one-to-one help, we can make that happen too. We have the resources for that come the next contract year in about a month, give or take. So reach out. Your opinion matters to us, and that's really how you are heard. Any questions, let us know, and I'll turn it over to April and to Dr. Lydia. Thanks. Thanks, Sierra. Thanks, Dr. Lydia.
Hey, everybody. I'm Sierra Royster. I am the Director of Innovation with April, which is the Associations of Programs for Rural Independent Living. Really excited to be here. I'm actually helping Mary out today. So this cohort will be led with Mary Willard. We kind of work together at April, and we'll kind of be bouncing off of each other, but we're going to take a lot of time with you all during the next 3 weeks to share all of her expertise and all of her experiences as well. So we're really excited to have her be a part of this. I am actually from a center in Raleigh, North Carolina, is where my IL experience started before I came to April. And during that time there, I worked with the youth programs. I worked as the director of programs and did multiple different events. And since I've been here at April, I've worked with the AgriBuIlity program, which helps farmers and those that want to be farmers stay in their jobs and also start agricultural businesses. And then I worked with our youth programs here, which often has to do with the pre-employment transition services. And we've worked with different centers on how to start that as well, along with many apprenticeship programs that we've worked with different national partners on trying to get started as well. So there's been lots of things that I've been able to do around employment. And so really excited to kind of help everybody get these programs off and running, because I know this is an area that many SILs were very interested in. So I see that Mary has popped in, so I'll let Mary introduce herself before I continue, but keep going.
Thank you. Can you guys hear me? Wonderful. Thank you so much, Sierra. So my name is Mary Willard. My pronouns are she, her, hers, and I'm the director of training at April. And I'm in Montana. I think today we were hoping to also kind of figure out where we have these names of our organizations, but sometimes that doesn't let us know where we are. And I'm just really excited to be here as well. So just talking about employment programs, in your introductions, we're hoping to hear about what you're doing or what you're planning on doing. So at April, we do have some pretty big youth programs. We're working on building up next generation leaders. We have some programs that talk about things such as negotiating your worth and employment, and those kinds of things. My background, I also came from a CIL doing youth work and running our peer support programs. But it was a long time ago. And so that's why we actually are bringing in one of our board members. Did Lydia already go, Sierra? No. Awesome. We're bringing in one of our board members and somebody who has so many employment programs and is doing this work currently to help us lead it. And that's Lydia. So I'll go ahead and let Lydia introduce herself, and then we'll keep going around the room.
Thank you, Mary. Hi, everyone. My name is Lydia Fonseca. I am the Director of Programs at Valley Association for Independent Living, which is in McAllen, Texas, a town South Texas, right across the border from Mexico. I'm also a board member at April as well. I am a Latina woman in her mid-30s, sitting in her home office with 2 portraits in the background and some blinds and some piles of office work on one side as well. My pronouns are she, her, hers. So I've been program director for about 11 years now. I've been working there at the center, overall supervision of all the programs we have, implementation, evaluation of the programs, grant writing, but really more than anything, just evaluating the efficacy of the different programs that we have. And that's really what we're going to talk about during these sessions, how to develop those programs, and then really how to evaluate them to make sure that they're working for us in our individualized communities. I'm happy to be here. I'm happy to share any kind of guidance. I'm welcome any and all questions. If I don't know them, I'll be sure to do my research to help you guys find those answers. Thank you for having me.
Wonderful. Thanks, Lydia. So what we're hoping to do today is, before we get into talking about outreach, we really want to know more about each of you. We're going to be doing some fast and furious group building and getting to material today. So if we could go around the virtual room and just say your name, your preferred pronouns, your organization, the state that you're in, and just tell us a little bit about your programs, whether you have an employment program, what that looks like, or if you're dreaming of building one, what you're hoping for, whatever stage you're in, that's okay. That's why we're here. So I don't know, and I will drop that in the chat as well. Oh, Sierra already did it. Great. Would anybody like to bravely go first and just tell us a little bit about you?
My name is Carissa Johnson. My pronouns are she, her, hers. I'm in Murray, Kentucky with the Center for Accessible Living. We kind of had an employment program prior to the pandemic, and now we don't really. I've been trying to get up and do some pre-ets and stuff now. We are qualified to do all of that, but it's been a little bit slow going. So I'm hoping to get some ideas and resources to help me along there.
Wonderful, and welcome. Great. Who would like to follow Carissa?
Hi, I'm Anna Thompson-Jones, and I'm from Sickle, Southern Indiana Center for Independent Living. I am located in Mitchell, Indiana, which is south of Bloomington, if anyone has ever heard of Indiana University. My pronouns are she, her. I am a 50-year-old woman with short blonde hair and glasses. And we are dreaming of being able to build employment into our center in a larger way.
Great. In a larger way, does that mean that you do a little bit of employment already?
I would have told you no yesterday or last week, but someone contacted us to help them with some test reading assistance for their orientation. And if they show up, we are going to be helping them with that tomorrow.
Wonderful.
So we are possibly launching in before we're ready.
That's okay. That's kind of IL.
Exactly.
Who would like to go next?
Hi, my name is Brittany Zaneri. My Center of Independent Living is Alliance of Disability Advocates. We're located physically in Raleigh, but serve a lot of the surrounding counties, which is in North Carolina. My title is the Information and Referral Service Manager, and my pronouns are she, her, hers. We do not have a formal employment program. We serve consumers with employment goals within the 5 core services, but it's based on what they would like to achieve, and it's based on like an individualized plan and basis. So I'm eager to learn more about the different programs and how we can improve that. Thank you.
Great. Welcome, Brittany. All right, let's keep this show rolling. Who would like to go next?
My name is Amanda. I work with Service Center for Independent Life here in Claremont, California. My pronouns are she, her, hers. I'm new here. I actually started as the ADRC program coordinator. So I'm taking this course to learn more about different ways we could help improve our community. We kind of do a volunteer basis. It's not really like a full employment program, but we try and get them in aspects of learning how to do certain things so that when they go into the workforce, they're able to be more comfortable with learning new tasks and communicating with others. So yeah, I'm basically here just to see different aspects and topics that could help me with my program, because we do transition and counseling, and I just am here to learn more. So I'm glad to be here today. Thank you.
Wonderful. Thanks for joining us. All right, who would like to go next? I think Carissa.
Hi, I am Maria. I am from Community Resources for Independence in Erie, PA. We have some resources about like job employment and where to go and where to start that process. And then we do also have a peer support program that we started up this year. But that's more for like personal goals and like learning things. And we just started that off this year, and I'm having a lot of like barriers and obstacles that I'm facing. And so I'm hopefully going to get some ideas from this and learn some more.
Awesome. Welcome, Maria. And we're hoping, we're hoping this grows a nice peer support group. So at the end of every call, we hope to have some time where you can just ask questions and we can all brainstorm together. So hopefully that's useful. Awesome. So who would like to follow Maria? I think we have maybe 3 folks left.
I can go. My name is Cecilia, and my pronouns are she and her. I am based in Idaho, and I'm a peer supporter. I'm still new in the position, and I'm here to learn different things. Our organization have employment program, but it's not like we don't help with finding them a job or anything. We help them with their goals, like what they want to achieve, those kind of thing. And it's called LINK for short, and it's Living Independent Network Operation. That's our center name.
Welcome. Thank you. We're almost through the group. Just a couple more folks.
I'll go. My name is Emily Robinson, and I work with Kelly's Kitchen based in South Carolina, and I also work with the Appalachian Center for Independent Living in Charleston, West Virginia. I've convinced the center to sign up as a CRP. So we are starting that lovely process, and we help with, employment goals and stuff like that. But we are wanting to build a long-term program and build that out. And so I'm here to learn on how we can do that. Well, the employment specialist will do that, but I'm here while we're looking for an employment specialist. So, my pronouns are she, her, hers. I'm based in West Virginia. And I think that answers all the questions.
Great. It's nice to hear a familiar voice. Good to hear from you, Emily. And for those just joining, a CRP is a certified rehab professional. Is that right? Or is it community rehab professional? I think it depends on where you are.
I think it depends on where you are as well. And I do apologize. I'm learning not to use abbreviation.
That's okay. We all speak in alphabet soup. Wonderful. I think I think maybe 1 or 2 more folks. Maybe. Candace, have I heard from you yet? I'm not. You can feel free to throw it in the chat as well if you'd like. Okay, well, I'm not sure if Amy and Sharon, if you wanted to introduce yourselves as well.
Hey, I kind of set the stage really quick in the beginning, but Amy Gonzalez, great to meet you. I'm the DETAC project manager. I'm a Hispanic woman. I am 40, as my daughter announces to everyone. I go by she, her pronouns, and I typically work for my home office. My virtual background is a bookcase I used to have a beta fish tank, but the poor guy is dunzos. So now it's just a bookcase. I'll turn it over to Charnett so he can give his description and introduce himself.
Yes,
Thank
good afternoon, everyone. And my name is Charnett Weldaab, and I'm the project coordinator for DETAC. And right now I'm in my home office, and my background is an ocean, a picture of an ocean hanging on the wall. And I'm wearing a blue and white shirt, and I'm Black African. And I go with the pronouns of he, him, his.
Thank you.
Thank you.
Wonderful. I'm so excited for this group of folks. I'll let you know that you are our second group. And because the first group that we had was folks that had some programs that were a little more established, you get the added benefit of getting to use some of their resources. So we will make sure to send those out following the calls. We'll send out other people's flyers and information. But just to let you know, we also will ask you all to sort of go back home, quote unquote, or back to your office and think about some different activities before we meet the following week. So make sure to watch your email. There'll be lots of stuff coming in and out, hopefully. But I think today, where we were hoping to start is just this idea of outreach and sort of building your community when you're just getting going. So I'm going to turn it over to Lydia if you don't mind talking just a little bit more about your programs and leading this discussion around outreach and where we start.
Absolutely. So there's different employment programs that we have, but the way we got started, and I think the way that all of us can kind of look at this is asking three basic questions, right? One, do we currently already have funding sources that will support employment services to people with disabilities? And the answer to that is yes, for all of us. All the funding that we have, as long as around IL, employment is a big thing, right? So we already have the funding sources. So I know some of you guys have talked about looking for funding sources or establishing a different type of program, but really right now we do have that funding source. So that's the first question. The second one is, do we have any kind of written program policies or procedures to be able to start a program like this? Some of us may not, because the funding sources that we all have right now is just like your basic 5 IL courses, right? Core services, and we all just kind of build from there based on our community. So we'll talk a little bit about establishing actual written policies so that we can have guidance and really like a training manual when we hire someone or when we hand the baton over to somebody else to be able to continue providing employment services. And then the third is there a need in your community? Have you had consumers come to you and ask you anything related to employment? And more than likely, yes, we all have, which is why we're here today. And when you start, that's really the first way we start all of this and how we started at our program. And then what we did is we identified different partners that could potentially help us. And I think we all typically think about maybe businesses, maybe our local state VR. And I know that could be something we're going to talk a little bit more about in the future, because building that partnership or even mending that partnership may be something that we all would like to look into a little bit more, because that has been an issue in the past for a lot of centers. But then we look at some atypical partners, maybe the school system, the school district, because we got to look at it in the different age categories, because youth are going to look at employment completely different from adults. Adults are going to look at employment completely different of when they probably acquired their disability. Maybe they are new and adjusting to a disability they've acquired as an adult. They're going to be seeking services or requesting employment related services very different from someone that may have been born with their disability. So those are the different things that you'll have to look at as well. And then another atypical partner that is not very common around the United States are your disability chambers of commerce. There's right now 4 in the nation. 3 of them are in Texas. We're very lucky to have those here, and 1 in Florida, I believe. And so maybe even looking into potentially in the future, once you've developed partnerships with a lot of different community organizations, having someone or supporting someone to be able to develop a chamber of commerce in your area. And that could be something we could talk about in the future too, because they become key partners in moving forward with all of this as well. State VR services, school districts, and chambers of commerce and other community partners. So once we established those partnerships and who we wanted to kind of target, then we went forward, right? So the school districts, some of us already have great relationships with our school districts. And I'm talking about our youth with disabilities, right? And if we do, when we go in there, the transition services, a big part of that is employment services, pre-employment services. Some of us have, I think, said that they're CRPs or they've established some relationships with their state VR. So employment transition services, right? If another way that we could go about it too is actually doing summer camps or hosting certain events at our center where students could come to your center and do that. I think one of the things that I read over one of the people that requested this cohort was how we can, with limited amount of staff, employees, how you can expand your program or reach more people in employment services. One way is to do it in a class format. I think a lot of us typically think about one-on-one services because that's what we do in IL mostly. But when you think about doing it in class formats or events, that can open up a whole other world for you. So we can look into that. That's how we started as well, expanding our program. But the main thing, and I know that one of the things that Mary talked about is outreach. How are you doing outreach, and how does outreach look like in your neck of the woods? So for us is a lot of community health fairs, a lot of back to school fairs, a lot of really door to door to different businesses and handing them our brochures and business cards. So anytime there is an event, a community event that is available, we always had a staff member sign up for it and attend. For whatever reason, if they couldn't go or you're limited in staff, they more than likely will allow you to let you give them like brochures or information about your agency already, even if you can't attend in person, and then they would disseminate that for you. Another thing that a lot of communities really, really like is if you have the opportunity to go and present on your services. So really putting yourself out there in those different kinds of outreach ways is going to get your name out there, one, your center, and then two, the type of services that you can provide. And I think the best thing is that the moment you have a success in any kind of your programs, not just employment services, but let's talk about employment. Let's say you've successfully placed someone or you've help someone with assistance in test reading, right, for a job interview or orientation, and they've successfully gone through it. Those are success stories that you need to be presenting out there and using in your outreach, because that's what gets people more interested in letting you be part of their programs and serving their population, which is essentially the same population that you serve too. So I don't know if you guys have any questions or anybody would like to share the type of outreach activities that you guys already do, whether it's for employment services or for any kind of other service you provide at your center. And then we can discuss how we could modify that for employment services. And if it's silent, I don't know. Go ahead. Yeah.
Yeah, no, thank you, Lydia. This is Mary. I just wanted to add, and so if anybody would like to share, maybe what are some partners that you already do outreach to or that you've tried connecting with? And another fun activity is when you're just getting started is to think about what you already have at your organization that people might benefit from. So we could also talk a little bit about that. For example, if you have a computer lab at your CIL, that might be something you could, suggest people come in and use to write resumes. So thinking about who you already do outreach to and what you already have that might be a benefit to others. Would anybody want to share?
Hi, this is Brittany. We don't have specific outreach that we do related to employment services. However, we have general outreach We do a monthly newsletter with any events that are going on with our organization or in the community that we send out to hundreds of people who've signed up to be on a newsletter list. We also maintain our website and social media. And prior to the pandemic, we participated in community events where we could talk about our agency and what we did. We haven't really been able to successfully institute that, except recently we were able to go to a Disability Pride parade in July. So we're hoping to get back into the swing of things and participate more in the community. Thanks.
Mary, can I add to that? Or hi, Brittany. So immediately, I think a great first step to involve is maybe go through your, what state were you with?
North Carolina.
North Carolina. The force agency or state agency or your local workforce, usually they post a job postings online, or they update it weekly. So what I would do is get those posts. I don't know how often you do your newsletter, if it's monthly or quarterly but get those posts and add that to your newsletter. You could have like an employment corner and then just have job posts, and then people will start seeing job related things to that. And that's one way you're starting to do outreach and INR really for employment related services in the easiest way.
That's a great idea. Thank you.
You're welcome.
Wonderful. Who else? And this is also a great spot if you're not doing outreach. If you have a specific outreach question you'd like to brainstorm, we could talk about that here as well. So I did put it in the chat. Cecilia asked, what outreach are you doing already? Or what questions might you have? What might you already have at your organization that you could offer?
This is Cecilia. For us, we do a brochure every time whenever we have event coming up or plus something. We send out brochures, and sometimes consumers come into the office and we share with them, this is what's going to happen next. Like in September, we have independent living conference that is happening. So we have a flyer for that, and we're just sharing with people, and that's how we reach out. And talking to some organizations that work with individuals with a disability.
So I think that's really great, because anytime you have an event or any kind of promoting a service, the best thing to do is share, that tangible material. And I'm not sure how your area is, but sometimes there are persons like in areas that don't have connectivity, or maybe they haven't even reached out. They don't have internet to know that there are services or there is a center, so they don't know how to sign up or get those brochures, attend events because of the lack of accessible transportation, which is a whole nother issue related to employment as well, and a lot of other IL issues, right? But one of the things that is important to do when you do brochures is, I'm not sure if you're familiar or if in your area there are programs that are called community health workers. Have you heard of those role? And they usually go out into the areas, and I'm not sure if every state has that through the state program, but community health workers are people that literally go door to door in rural areas to provide brochures and things, services related to their needs to vulnerable populations. So I can definitely get a list. I'm not sure if you do that already, but they'd be a great partner to have, so they can continue sharing your flyers and stuff that would help expand your outreach.
Yeah, we partner with them too.
Perfect.
Yeah.
Wonderful. Anybody else?
I know in West Virginia, one of the things that we have started to share is some of the staff has gotten involved with back to school events and transition fairs and also employment fairs. So, and it's literally, we Googled it and found the phone number, gave them a call and said, hey, can we have a table? And so that's really how they got started with that. And we have designed brochures and with general information, and then we encourage them to call us, and then we can give them detailed information based on what their individual needs are.
Great, thanks for sharing. Oh, go ahead, Lydia.
I got out, so I didn't hear the end. All I heard was we designed brochures, and I'm not sure what happened after.
No,
sorry, my internet's spotty today.
love,
yeah.
that's okay. I love that. Thanks, Emily, for sharing that. I think Emily was just sharing that they just literally Googled some numbers and started sending info. I think that's we all had to start there at some point. And actually, one thing that we are hoping for you all to think about for your after the group assignment is what is your elevator speech? So we're really talking about when you're just cold calling somebody, thinking through what information you give them about your programs in order to I guess entice them to wanting to partner with you. I don't know if anybody has an elevator speech, or if Lydia, if you have an example of one that you've used in the past.
Yeah. So first of all, yeah, I love what she said about just calling. That's sometimes the best thing to do, right? Is reach out to that. And now that you've gone to those, they're going to have your number, and believe it or not, they'll be inviting you each time you go there. And another thing I definitely recommend, which your center may have done when you attended all those fairs, was at the fair, give your business card to all the other tables, because those community agencies will then have events in the future, and you'll be on their distribution list and contacted as well. So definitely recommend that. But in terms of the elevator speech, I think one of the things, it's going to be unique to who you're calling, right? And the main thing you always have to remember is people will perk up their ears and listen more when you use their language. So if you're calling a school district or a school to find out if they're having a back to school fair, always say students. Don't say youth with disabilities, or the language we use, say your students, right? Your students, or say, hey, these are the types of services that we can offer to your students. If you're calling, I don't know, a chamber of commerce or a business, depending on, they might use clients, they might use customers. So making sure you do a quick search on their website of what they consider their population, that's going to make them think, connect, and say, hey, we do serve the same population. So definitely when you're building your elevator speech, terminology is key. Use the same language that they use and keep it brief. Just say we're a nonprofit. We're not going to, we don't charge. This is what we can offer to your students, your clients, your customers. And then go from there.
Great. I think for those who are just starting brand new, another really good spot to start is to think about what the consumers in your area need and want. I'm curious if any of you all have done a needs assessment or focus groups or any other ways of trying to reach consumers to find out what your area needs. Is that anything that, that you all have done before, or have any thoughts on? Lydia, do you have any thoughts on I'm curious, when we were doing youth programs and employment programs at my CIL, we tried to reach out and find out what young people were saying they needed to get ready for employment. And we also worked closely with our VOC rehab teams to find out what kinds of employment services or skills some of their other folks were missing. I'm curious, what did your SIL do in the beginning to sort of start dabbling into what to do first, what programs to offer first?
Same thing like you. Yes, absolutely. So when we were talking with our youth, the main question we ask, and I think when we are all going to start providing employment services is, what kind of career you're looking at, right? I think what we did mostly were like job task analysis, meaning we reached out to businesses and basically said, what are the things that are required to complete these tasks? And what are the most, and what we did also during those calls were basically to figure out what's in demand, what type of jobs are in demand. And then we would take that back to our user, to our consumers and say, hey, more than like in this area, this is what, and it's going to look different everywhere. It's going to look different everywhere. And so what we did is we really kind of did the back end research so that we can really focus on hopefully successful placement in the future. So if we knew what was in demand, if we knew what was required to complete tasks, and then we asked our consumers, what exactly do you want to do? And then kind of let them know this is what's out there. We were more than likely going to be a little bit more successful and it just grew from there. They started seeing that, hey, they do have more of a possibility to be in place because there are jobs available in this area. And then we made a plan from the very beginning on how to train them for those specific positions that were available. So I guess in sum, we talked not just to our consumers, but we talked with businesses too, because I think that's really where we have barriers as nonprofits, as centers. We are always with our consumers and we hear them, and because they're our priority, right? But in order for us to really link them, we have to understand the other side of it and who we're trying to link them with. So having that communication and what the needs of the businesses are too is what makes that's how we started building our programs from there.
Curious, as we're just sort of building our group and trying to figure out what we need to talk about, what other questions do folks have? I know we have the questions from your applications, but what would you like to brainstorm? Has anybody started this process and have had some barriers or maybe having a difficult time finding traction that you'd want to talk about and brainstorm together?
I think hearing about the issues to starting these programs is going to be important so we can know how to address them. It could be lack of funding, lack of staff, lack of training. I mean, it could be anything.
Hi, this is Brittany. I think the biggest barrier right now is we have gotten an increase in requests for working on employment skills and finding jobs. So starting an employment specific program would be fantastic, but our biggest request continues to be basic needs. So housing, navigating community resources in order to find food, shelter. Homelessness are the biggest barrier right now. So people in the basic needs scenario, like their long-term goal may be able to find a job, but their short-term is worrying about where they're sleeping. So, and of course, time and funding are always going to be barriers.
Yeah, absolutely. I'm curious, Brittany, do you guys have, is it common for y'all to have an IOP open, for example, for like a year, 6 months? Is there a time frame? How do you guys do it?
Yeah, there's no specific time frame. It's really consumer based. So some of our consumers work with us for 6-month periods of time, but a lot of our consumers want to work with us longer. Once they complete an initial goal, they form another goal and they want to keep working with our community inclusion specialists. So discharge is actually a little bit challenging when it comes
I think it is. Yeah, I think it is for most those. They want to continue coming back for more services, or the need is there, right?
Exactly.
So I have a question. Do you guys have, I'm sure you have an intake process when you bring your consumers in. Do you have employment related questions in that intake?
Yes, like, would you like to continue, would you like to go back to work? But it's person-centered. So,
Right.
and it has like a lot of open-ended questions. So if they've indicated that they've worked before, that would be one of the questions. Or would
Right.
you like to work, is one of the questions we do ask.
Okay, great. So I think that for sure, people whose main priority is shelter, housing, we have to, as IL specialists, we have to address those basic needs first. But I think that every time we go back and follow up with them, however often that looks like for your center, whether it's monthly, 90 days after they've completed a goal, we should always re-ask those employment questions. And I think bringing it up each time will remind them that, that assistance is there, or once I finish this task, I can get to that. And that way they can keep that in the back of their mind. So I don't know if implementing every time you follow up, you have like a mini version of the intake, or if you guys flag certain questions in the beginning and then kind of go back to them each time. But I would do it that way, but for sure address their basic needs first. But in order to keep employment services in the back of their head, I think we have to constantly be reminding them that it was something they initially wanted.
Right. And I like that idea of flagging the initial responses and being able to refer back to it.
Wonderful. What else, Lydia? I'm so glad that you're here. I didn't even think about that, adding questions right to your intake. So if you're just starting from square one, that's a great way to sort of get the info right from the consumers. You might even be able to add extra questions in there, such as what's been your biggest barrier to employment if you aren't employed?
For sure. And that keeps it person-centered, so that when you're building services around them, it's based on their barriers, their needs.
What other questions did you all have? Or if you have experienced barriers when trying to do outreach, what are they? What's been your biggest barrier to getting an employment program going that we can maybe brainstorm around?
I think for us, it's been, there's other programs already established, and we are just an office of like 3 people. So it makes it hard to kind of sell what we can offer versus the other programs.
I feel you, Carissa. And I think in an instance like yours, the best thing is to build partnerships and leverage resources. And what I mean by that is however many other organizations already provide the service, the last thing we want to do is duplication of services, right? But we also want to be able to provide the specialty services that a center provides. And now I don't know what other agencies provide this, and is it specific to persons with disabilities and employment services?
Yeah,
Yes,
we're
okay.
talking about pre-eds and pre-voc and
Okay.
all that stuff, yes.
Right. And so one way to partner up is maybe the pre-eds people and people who already do pre-eds or thinking about pre-eds. It's a lot of work, a lot of paperwork, and it's a lot of things to do. So one way is you can reach out to that organization and say, hey, I know you guys do a lot of one-on-one and you're doing your pre-eds, but I can come in as a pre-mentor, pre-advisor, pre-tutor, however you want to call that. So for example, one of the things that we do at our center is our state VR, does a lot of, job placement, one-on-one services. But one of the things that we do is we try to prepare people as much as possible so they can be successful in those services. Very quick example. Right now we're working with a hospitality group in South Texas that owns a lot of hotels, and they're working with our local VR agency to place persons with disabilities in positions, whether it's in the hotel kitchen, in the front desk, in different areas at a hotel, right? And so VR refers their customers, and then they go and then they provide them with all the supportive services. But the way we came in and we said, hey, we'd like to partner is what kind of, for example, the kitchen, what kind of kitchen tools do they use? What does your onboarding look like? How does your orientation book look? They shared the job description. They shared all of that with us. And so what we did is we told our VR people, hey, your 5 or 6 people that you're going to refer for kitchen to be cooks or to work in the kitchen in this hospitality group, send them to us first. We already have all the material. We're going to prepare them with the job description, with the tasks. We're going to buy the adaptive equipment that they need to be successful. We'll train them for a couple of weeks. And then when they go, their onboarding will be like this, and it'll be a lot more successful and they'll be placed right away. Does that make sense? So it's like that additional supportive service that you can help out in that kind of way.
That makes sense.
Because you know your consumers more than anything of how they're going to be successful. VR just focuses on employment. Not that they don't know them, they do, but their main goal is employment and services. But if you're already working with the same customer, they call them customers or consumers, then it's best to give them any kind of free training beforehand so they can be successful. That's going to build partnerships. And in the future, you'll probably be another pre-ETS provider because they're going to want you to get that contract because you're already providing those services.
Well, thank you.
This is Mary. I think, Chris, I just want to say, I think you're not alone. I think one of the most interesting things about an independent living center is that that makes us different is that we are both serving consumers as a provider and also building a movement. And I really think that, I know we're already getting towards the end of this call, but, you know, like today we were really hoping just to help build this group so that we can really rock and roll into some meat of the material next time. But, when everybody goes back to your offices and really thinks about what your elevator speech is to start breaking into the community, I want you to maybe think about, you know, 3 things that makes us unique. And I think that's really the big part, right? We're building a movement. So we have an opportunity to involve people within our center. And maybe that's something you want to talk about in your uniqueness. I know one thing that we did at my Center for Independent Living was not only were we teaching these soft skills such as how to write a resume, you know, the importance of showing up on time, dressing for success, planning out your transportation. So we were teaching those skills. And also people were practicing those skills just by coming into our center. And sometimes we would even incorporate those consumers, that's the building a movement part, right back in. So, you know, I would say we had a young person, for example, who used to come to our employment services program. And then also they would help lead some of the discussions. So they had been coming for quite a while and started becoming familiar with it. And that was something then they could put on a resume. You know, I volunteered to lead this discussion, or I have had some practice with public speaking. So I think independent living, you know, what makes us unique is that we have, like Lydia said, that peer support. So working that into your elevator speech. We are all people with disabilities who have experience with work. And so we can help brainstorm around the potential barriers with consumers so that they can set up for success. And then I think the other thing is just real life practice. We have so many opportunities to include people in what we're already doing, giving them those opportunities. So that's just 2 of the different things I used to talk about with community providers on how we're different. I think the other thing is that you all probably noticed this in your communities. Service providers are like really disjointed. you have to go to this one to help you with your personal care and this one to help you with transportation. And the neat thing about independent living is we're kind of like a catch-all net. And so if somebody comes to us to learn like employment skills and then you realize they don't have any transportation, then you can also work with your travel trainer on, this is how to sign up for paratransit and help walk them through that. Or this is how, to use the public bus. Maybe you even are helping them study for their driver's exam, if that's something that they struggled with. So all of those can fall into your employment services as, soft skills, really setting them up for that success. So that's just, sorry, my long-winded way to talk about my love affair with IL and how we can really help with all different kinds of problems.
No, you nailed it. Yes, absolutely. The no wrong door system, right? It's really what we are. And that's what you want to use in your elevator speech. One, their terminology, the population they serve, what they call them. And then the IL philosophy, your movement, and how it's a no wrong door. Because businesses that's the last thing they want to do, is have to deal with so many different agencies to get services for them. It's gonna help your pitch if you tell them that really you'll be able to service them with all the different needs. So Mary's absolutely right. Yeah.
Can't believe that it's already 12:57 my time. We just wanted to let you know we're so excited that you are joining us with this group. I know today feels a little bit clunky. That's sort of I think the beauty of building a group is working through those norms and getting to know each other, figuring out how we're going to work together. For next time, I think what we would like to do is talk a little bit more about deciding what to do at your center. So where are you going to start with programming? That might be thinking about what you already have to offer. And it's also going to include working on that elevator pitch. So if you had 1 minute with somebody, what are, the highlights that you would tell them about your organization? And we're hoping that we can share some of those in the email group as well. So if you want to take some time to write out maybe, 3 to 5 sentences about how you would describe your organization, and we can send one as well. And then we're going to send out at the end of this call some of those tools and resources from the last cohort. And if we're hoping you have some time to go through those, or at least some of them, so that we can start brainstorming what to do with folks and questions that you might have. Did you have anything else to add, Lydia, for next time?
No, I think that's good. I think we really want to be able to assist the different needs of your community. So for sure, bringing that, I think when we talk about the 1 minute elevator pitch, we'll be able to see everyone's uniqueness. And that's what I really want to tap into, the unique needs of your community, because that's how we can then build that program that everyone.
Wonderful. Well, thank you all again for joining us. We will send out these resources and an agenda for next time so that you can be thinking about, what we're going to talk about. And if you have any questions at all, you're always free to email us or the group. We're hoping that this is beneficial and that we're building a peer group that can continue to work past these 3 calls together. All right. An hour goes so fast. I feel like you blink and then it's done. But we'll see you all in the same time, same space next time.